We're here in Clarkston, Georgia, in the heart of Clarkston, Georgia, at the Clarkston Community Health Center, where a very exciting healthcare center has opened to respond to the needs of the refugee community. Join us. I'm here at the Clarkston Community Health Center with its founders, Dr. Gulshan Harji and Dr. Saeed Raiz. Thank you so much for joining us to talk about this very exciting clinic. Now, first of all, tell me what inspired you to start the clinic?
Well, I've been working in this community for the last 5-6 years, and we have been coming here providing food, shelter, and housing needs of the community. And every now and then when I would come in, there will be questions about healthcare, because these refugee community are very sensitive to healthcare issues. They are culturally sensitive, linguistically sensitive. Women do not want to go to male doctors, so normally they would not go to doctors unless they're driven to ER. So I was being asked every time I came in, they knew I was working for Walgreens, I was a pharmacist, and so they asked me, what can we do? So I've been thinking about it, and my work with Walgreens is also to deal with the federally qualified health centers in Southeast, and I set up Walgreens partnership with them. So I came across a lot of these federally qualified health centers where they were helping uninsured and underinsured people. So I decided one day, I went over to Dr. Harji and I said, I would like to set up a clinic in Clarkston to help out these refugees and uninsured people who are living there. It took her 2 seconds to say, yes, let's do it.
Actually, it was so interesting that when Saeed asked me, this was something that I was also already thinking about, because my practice is on Lawrenceville Highway, and so it's about 3 miles from Clarkston. And often when we saw new refugees, one day suddenly they have no health insurance, because they only get health insurance for about 6 to 8 months. And so what happens when they suddenly run out of health insurance? So I had often thought about, well, what happens to these people, and how do we take care of them? Because just because you don't have health insurance, it doesn't mean that you don't need health care. And so it was such an interesting coincidence that when Saeed asked me, I said, wow, here's an opportunity. Let's just do it.
Clarkston is a city in DeKalb County. Over the last 3 decades, it has become a haven for refugees from all across the world. Clarkston is noted for its ethnic diversity, and it is believed that half of its population is from outside the United States. This growth began in the 1990s, fueled by refugee resettlement programs that identified Clarkston as a good fit for displaced persons.
My name is Jim Anderson. I'm the chairman of the Clarkston Community Health Center, Inc. Clarkston is a rather unique community, and it has a large portion of its population is refugees and indigent population. I think 67% of the population is either refugee or indigent. And there's been a need for health services in this community. I've been involved with Clarkston for almost 20 years in one form or another, providing certain charitable things that we've done on the community. When I first heard of the effort to develop a health service, I thought that this would be a great opportunity to focus some of my work to get involved in this community and to help out and hopefully elevate the health situation here in the community. They come here with great expectations, and they come here with such, looking at it as a very bright future. And sometimes they get a little discouraged because they have to learn a new language, they have to learn a new system, they have to get on a public transportation and do other things that is very foreign to them. but eventually they come around and they become model citizens in the United States. And as a son of an immigrant myself, I can tell you that the road to success is fraught with all kinds of problems, but we want to make sure that health is not one of those issues.
What are some of the needs of the community that you address?
We provide primary health care and pediatric care. Kids who do not have insurance. A lot of kids who come here through refugees, it takes some while to get peach care, so while that period we cover them. And we also recently started a mental health clinic twice a month. And we are planning to start a dental clinic towards the end of this year. One of Dr. Cchc's friend, who's a dentist, closed his practice, donated all his equipment to our community center, so we put it in storage for now. So we're looking into getting a next door space, and once we do that, we'll start dental health as well.
Plans for the Clarkston Community Health Center continue to expand. Its goal is to become a center for overall wellness. Patients will soon be able to get free dental and vision care at the center.
We have felt for a while that there is an urgent need for medical services for these people who come in as refugees or are indigent, and there is a large concentration of them here, and this location, we think, provides them with the facilities that they have long lacked. So we have started this effort. We are in need of volunteers. We are in need of anybody who has expertise in the healthcare fields. We have need for just expanding this so that it can fulfill its promise for these people who need these services. We're trying to provide basically primary healthcare services, preventive healthcare services. We are now attempting to form partnerships with larger organizations that can take on some more, as it were, deep dive into the healthcare problems that these individuals may have that might require detailed imaging services or further care, so that there can be a seamless method of dealing with their healthcare issues. So we need to form those kinds of partnerships with our neighboring larger hospital systems. At the same time, we are also trying to set up an electronic medical record system here, and we need expertise and people who can work with those kinds of issues. We have been very lucky to obtain donations from the City of Hope Pharmacy that allows us to provide medications for no cost, at least the simple ones that are ordinarily required for common diseases to these individuals. So that, I think, is a major step forward.
What went into actually establishing the clinic? What did you have to do to make this happen?
I'll let you answer that.
Well, after Dr. Cchc agreed, then I went to some of my friends, and Ben Johnson, and I sat down with Ben, and I said, Ben, this is what I want to do. I have been involved in a lot of mosques around in Atlanta area, and I was on a board of Alpharetta, and I resigned from that. I said, we need to do something for the community, and I have been working with Ben with interfaith activities a lot, so Ben got on board, and then we started reaching out to other friends of ours, doctor friends and non-doctor friends, and everybody felt that was a great idea. And so we set up a nonprofit organization, and then the most time it took was to find this place. There was not too many places available. And Clarkston, we wanted to be in the heart of Clarkston where people can walk to because the transportation is a big issue here. And so we wanted it somewhere where people can walk to, we don't have to worry about taking buses or asking people to drop off. So that's how this whole thing started.
The Clarkston Community Health Center could not operate without the gift of time and skills from those who volunteer. Medical and nursing students from Emory University, Clayton State, and other schools find their time at the Clarkston Community Health Center well worth it. They receive the clinical experience they need and a unique training that will help them further their careers. It also gives them the feeling of doing good to help others.
Hi, my name is Claire. I'm a senior in Emory, and I first came to the clinic from a pre-health club in Emory, and I really liked the hands-on experience and wanted to help out the community more. So I wanted to be a regular volunteer here, and that's how I started to volunteer at Clarkston.
Hi, my name is Cchc. I am an international medical graduate. I have been here since June, and I love to work here because here I can get medical clinical experience and also get really good chance to work with great doctors. I can learn a lot, and at the same time I can help many patients. They really need help.
Hello, my name is Hiroshi. I'm a senior at Emory as well. So I guess I'm here because of the service that we provide. I think it's crucial and important that this organization is here to provide healthcare to the people in need, and I feel a great merit in being involved in this.
Hi, my name is William Kang. I'm currently a senior at Emory. I'm studying biology, and I first found out about Clarkston Community Health Clinic through Cchc, which is where I work, and I was able to meet Ollie and the other workers here through Cchc, and it's been a great experience. I've been able to, get some hands-on experience, some clinical views, and really get a feel for what it is to be a physician and to be someone who gives back to the local community. And it's been wonderful, being able to work side by side with these physicians and researchers and, get a feel for what medicine is really all about.
Hi, my name is Ravila. I'm also a senior here at Emory. I wanted to contribute to the community because Clarkston Clinic's a great opportunity to really find out how to truly help a refugee community and how to help their needs and such. And it's a great experience to have.
And I'm Mia. I'm an Emory nurse practitioner student, and I've done some previous work with the Clarkston refugee populations, but when I heard that this clinic was opening up, I knew that I really wanted to be a part of it because it's providing such a necessary service, and it's a really great opportunity to watch a community health center being built from the ground up.
Great. My name is Ali Khan. I work at Emory Cardiology Research, and over the last 5 years we've been doing various health fairs in the community, and we realized over time that the health fairs just weren't able to meet the needs of the local community. This community has a lot of health needs that need a proper clinic setting to be able to address, and so over the last years we've been accumulating this awesome bank of volunteers that have come to our health fairs in the past, and we've managed to sort of bring them all together, and I kind of work with them to try to engage them and give them specific roles and things that will help them not only learn and sort of get a good understanding of the healthcare field, which most of them are all healthcare bound students, and so definitely it's been my pleasure to work with them, and I think this community really needs this, and it's a pleasure to be here.
I have been with Clarkston Health Clinic since February. I started here as a school assignment and have stayed on because it's just an amazing place, and I love working with the people here, and it's just been an experience like no others. I work in the hospital, and this is completely different than hospital work. The people here are very accepting, and they're just great people to be around.
Hello, my name is Jennifer Butler. I currently work as a medical assistant. My end goal is to get into medical school, so this was a really great opportunity for me because it helps me really decide why I wanted to go into medicine. The people here, you take their blood pressure. I've never seen anyone who's so appreciative of the little things that we do, and for that's why I keep coming back.
My name is Ramata Bangura, and I'm also a student nurse at Clayton State University, and I'm here also on community service, and I really like it here because it's a great learning experience. We get to learn a lot from our patients and the great nurses and doctors here, and I think I will come back.
Hi, my name is Brittany Hartman. I'm a student nurse at Clayton State University, and I'm here on community assignment. It's a great opportunity to see what nurses do outside of the hospital, which is the only place we've really ever worked as student nurses, and so it's been great to see the different types of people that are helped in a community clinic like this, and the awesome nurses who are volunteering their time and the doctors volunteering their time, and it's just been an awesome experience.
I'm Professor Susan Estes, and currently I am a nursing professor at Clayton State University. Formerly I was at Mercer University, and one of the courses that I really enjoyed teaching was community nursing. So I had asked to be put into that course, and one of the things that we do is we look at population health within a community. And that means that we're going into the community, we're assessing the community, and we're looking at healthcare disparities or healthcare needs within that population of people within the community. And from the disparities that we identify, we develop programs and implement those programs to make a difference and to lessen or eliminate those healthcare disparities within that population. And in teaching the community course, I had 6 groups of students, and Diana, that we just met, she was in one of those groups and initially made the contact with the Clarkston Community Health Center.
What are some of the challenges you faced in terms of getting the word out? Did people come immediately and receive the services?
I think that word did get out very quickly when people are looking for health care and the price is right and the community is there. It doesn't take very long for people to find out that here is good quality care, and we are here in walking distance.
And I think it's also great that you have this clinic here because, we've just heard sirens in the background, and so many people rely on emergency care, and having this clinic here prepares them for something different and gives them another way to address their healthcare needs.
I also served on the board of DeKalb Medical, and it was very easy to see why the financial health of hospitals suffers. And one of the reasons is because when people don't have health insurance and they don't have preventive care and they use the emergency rooms for ambulatory things, it runs the hospital into the hole. And also, when you don't get preventive care and you show up at the hospital with a blood sugar of 600 and a heart attack, what happens to a hospital? And so I believe that Clarkston Community Health Center is one of the ways to prevent those kind of fatalities. In other words, we're giving primary care, and we are to some degree perhaps postponing these events. And so really hospitals need to realize what it is that we're doing at Clarkston Community Health Center.
Relocating to a new city is difficult, but moving to a new country can be traumatic, especially if you are a refugee, where you are forced by life circumstances to leave all that is familiar to make your home in a new world. The Clarkston Community Health Center wants to ensure that poor health is not an obstacle to starting a new life. How important is cultural awareness when you're dealing with people from different countries with different languages?
It's very important, especially in healthcare, to completely understand the patient's complaint, because it's really understanding the patient's complaint that translates into the physician understanding exactly what the problem is. And that is what we provide here at Clarkston Community Health Center. As you see, all our volunteers that spoke the number of languages that we speak here is pretty phenomenal. And the accuracy with which these translators can translate for you, because that's also very important. And so we are able to provide this care in a culturally, ethnically, and linguistically sensitive manner.
We see a wide range of the population. As you must know, Clarkston has over 60 different languages being spoken in this area. We have people from all over the world. All of these people bring very diverse culture, language, religion to the area. We try and cater to them as much as possible. The way we do this is we try and provide a more welcoming environment for the patients to come to. We try not to turn anybody down, provided they don't have health insurance. We have translators available so that large percentage of the population don't necessarily speak fluent English, if any. We do have a large base of volunteers who speak many different languages and help translate. Even if they're not here, they can do it over the phone. That is a big assistance to us. So the rest of the population itself, we get a large population of walk-ins. We see a wide range of different people from different countries. We've seen Nepalese community, Bhutanese community, a lot of the South African communities. We also see a lot of the Indian or Pakistani communities as well. We are looking to diversify more so and trying to spread the word so that we can cater to more and more of these people.
شهر الواحد 2014 شهر الواحد جابونا على البيك.
So I asked her where I'm from, so she mentioned that she is originally from Iraq, but after the war in Iraq they moved to Syria and they stayed there for 8 years, but then the civil war started in Syria, so they moved from Syria as a refugee to USA starting from January 2014 because of all circumstances and all the problems that's happening now in Syria. ايه المشاكل اللي واجهتك لما كنتي هنا هوت بالاختلاف For example, for me, I speak Arabic and I speak English, so I try to translate between these two languages. We have another like volunteers that speak Gujarati, that speak Indian, they speak Urdu, they speak French, Italian, Spanish. I think until now we have different 7 languages that we can mix and match between them. And this is why we actually here, we just created a program as a radio broadcasting in which we are trying to explain different diseases like diabetes or high blood pressure in different languages. So we try to make like a broadcasting radio station in which in every week we explain diabetes, for example, or breast cancer in Arabic 1 week, in English in the 2nd week, in French in the 3rd week, and so on and so forth. These populations, the most important part is interaction with them, to understand the culture barriers, what they prefer, what they don't prefer. We have different perspectives of their cultures. This is why we know how to deal with them, and hopefully we will continue dealing with them as much as you can see in Clarkston here, it's the largest area of refugee in the metropolitan area of Atlanta.
If I talk to you about Clarkston Clinic, is the best place because when you come in as a refugee, 8 months you get the Medicare. After 8 months you're on own. If you don't get a job and if you don't get insurance, you don't have to pay. The health issue is very expensive. But we saw very happy this clinic to help our community and different community, all the refugees. When I'm talking about not only Somalia, we have Sudanese, we have Burma, we have Iraqi, we have Syrian now they come in. And this clinic, they help us because Burma, everybody come, because I'm all those family of community I visit, and they're very happy with this community because free. Because nobody has afford the doctor medical, the test or medical as a visitation. But this clinic, they help us a lot as a community. The other thing, advantage we have, we don't have the drive, everybody not drive. And we using buses and transportation is very high to go somewhere. But this one, they're very close. By walking apartment from here, maybe 2 minutes, 3 minutes. That's why they get good help for these people, Dr. Harshi and Dr. Saeed. When they start the program, we are so happy and still we let God bless them.
The fourth Sunday of each month is Pediatric Sunday at the Clarkston Community Health Center. On Pediatric Sunday, 10 to 20 children come in with their parents to be examined. This is the day you will find retired educator and volunteer Anchor Shepherd at her post, assisting parents with their children to ensure they feel comfortable at the center.
My assigned day to be here is the fourth Sunday of every month because that's Pediatric Sunday. But I come as needed and do whatever needs to be done. I like to make sure that I meet the children, and every child who comes goes home with a book to keep and a Beanie Baby to keep, which both the books and the Beanie Babies have been donated to us. It is the most humbling experience I've ever had to work here, and I do it with joy in my heart. I have, as I said, a passion for children, and to see them here with their parents and their families getting much needed care tells me that these children have a better future ahead of them.
It's not our interest only to provide primary and preventive care services on a limited basis. Eventually, what we would like to do is to provide a more holistic approach and get not only our patients, but the patient's family involved, and talk about issues related to health, such as nutrition and exercise and other things that will prevent disease and put them in a better position to reach full citizenship in the United States.
The Clarkston Community Health Center responds to the needs of those they serve, ensuring quality health care for the refugee, indigent, and uninsured populations in the Clarkston community and surrounding areas. They are looking forward to doing more and will with the help of dedicated volunteers, committed partners, and generous contributors. To learn more about the Clarkston Community Health Center, visit clarkstonhealth.org and make a difference in someone's life. I am Angela Harrington Rice. I hope you enjoyed this edition of A Woman's Place.
Clarkston Community Health Center.